All right, it is noon, so we will go ahead and get started. Good afternoon. I hope everyone's well. My name is Rishu Mahalha. I'm having some technical issues. Give me 25 seconds. I'm going to log in through a phone that will make it easier. All right, let's try that one more time. It's noon. Good afternoon, everybody. My name is Rishu Mahalha. I am the economic advisor with the program Growth in the Rural Ozarks, GROW. We are a program that spans across 9 communities in southern Missouri, southern central Missouri. Really glad to have all of you join us. This is our monthly business speaker event, a program that is been brought to you thanks to our local chambers of commerce. I want to thank a handful of chamber leaders who have really been instrumental in designing and supporting this program. We have Shannon Walker from Aurora on the call. She is the chamber leader there. We have Mary Oblander from Eldon. She's the chamber leader over there. From Buffalo Chamber of Commerce, we have Tanya Watson, and then we have Melissa Linsing in Herman. And so we appreciate all of our incredible local chamber leaders. They lift a mountain on their shoulders. So we appreciate everything they do. This is a program really to help our small, mid-sized businesses in our rural communities gain access to speakers, topics, interesting insights that can help them, our small business leaders, really support their growth and sustainability. In the last many months, obviously with COVID, the world's been turned upside down. So we're really thankful for all the speakers, including the one that's with us today, Tammy Long, who is, we're really fortunate to have her join us. I'll introduce her in a moment. I just want to share with you all just a quick plug-in for some of the other programs coming up around the corner, and then we will get our event today kicked off. So around the corner, we have, next month, we're going to be having the SBDC leader join us, Lauren Carter, who will be sharing with us how to access COVID-related funds. Obviously, it's a really important topic right now. And then in June, we're very excited. We're going to try something new. We're going to be holding a virtual business networking event. More details to follow on that. So those are 2 events coming up. And we will also post a survey at the end of this event. We always welcome feedback that our speakers, whether you're on our Zoom line today or you're joining us through one of our Facebook pages, we absolutely welcome your thoughts and guidance. So just wanted to welcome any comments you have. One final item I want to highlight is that we have a portal that is our Business 911 portal. And so if you are looking to connect with local resources, local programming, if you're looking to connect with any of our recordings of our past events and today's event, you can go to our business911.org platform and you will find all of our recordings from the past on here. And finally, if you want to learn more about our GROW program, what we do, who's involved, who are the communities, we welcome you to join us at GROW Ozarks, GROWOZARKS.org. There you will find lots of great detail about the program, and we're certainly accepting applications for more communities now. So with that, let me turn it to our speaker today. We are so fortunate to have retired captain of the Air Force, Tammy Long, who has an incredible career, just incredible experience and expertise, who's joining us today to talk to us about health support, healthcare for small, mid-sized businesses. What can small businesses do to access Missouri Chamber of Commerce's healthcare plan. This is obviously a really important plan. We are, as a country, we as a civilization are facing a once in a lifetime pandemic. And I know this is something that our businesses think a lot about. So this conversation is incredibly timely. Tammy has just a breadth of experience. She is with the Missouri Chamber of Commerce. Her formal title is Director of the Missouri Chamber Federation. In that capacity, she's working with leaders at Jeff City, ensuring that our chambers, that our small, mid-sized businesses are getting adequate representation. As mentioned, she was with the Air Force as a captain, and so one of the early females in that role. So she's a trailblazer for sure. And if you ever want to catch her, just look up in the Missouri Plains. You may see her taking her hot air balloon for a ride. So that's just an incredible person, and we're so glad, Tammy, you're with us. Welcome, and we can't wait to hear about your insights. So, Tammy, the floor is all yours. Welcome.
Well, thank you so much, and thank you to all the chambers for all the work that you do every day. We know how hard it is, and like Harishu said, the load that you are carrying. I'm going to go ahead and share my screen. So hopefully this all works good. There we go. Okay, I'm assuming everybody can see this screen. One of the things that we've done at the Missouri Chamber of Commerce is learn about what the needs of our businesses are. So as many of you are familiar, we started the Missouri Chamber Federation back in 2014. We now have 183 chambers across the state involved in the Federation. After we got the Federation going, we asked them and our businesses what the next area we should be focusing on. And everybody said the same thing. The rising costs of healthcare kept impeding our businesses from doing business. So we worked with Anthem Blue Cross and Blue Shield and actually stole this program from Ohio. And it's called a MIWA, or we call it the Chamber Benefit Plan. Our goal is to help our small businesses come together and have provide insurance for them. So let's see if we can, there we go. If I can get my screen to, oh, sorry, there we go. So the Chamber Benefit Plan is actually run by Anthem Blue Cross and Blue Shield. There we go. It's an affordable plan, affordable healthcare plan. It meets all of our legislative issues that we have to. If you have to supply the IRS with your certificate of health insurance, it meets all of the federal standards. And we kept hearing that the changes were going to take place at the federal level as effective of January 1st of this year. So we tried real hard, and we started this program in November of 17 to get it up and running and getting it available to all of our businesses across the state. Currently, we have over 30,000 personnel on the plan and over 3,000 businesses participating in it. So it is a self-funded multiple employer welfare arrangement, or a MIWA. So a lot of times if you're reaching out to people, they'll say, oh, you mean the MIWA? It's called MIWA, or we call it the Chamber Benefit Plan. It's a single large self-funded group, and it's available for employers that have 2 to 50 employees. It is medically underwritten. So those of you that have been around for a while, back in the late 90s, early 2000s, you had to medically underwrite all your plans, and it goes back to that. There's a fixed and predictable monthly payments, so it allows your businesses then to budget. There's 10 different programs and 3 different HSA options on it. And then we have an exclusive distribution channel just through the Chambers of Commerce. So why would an employer want to take part in this? This is saving them money. As a chamber, it's hard to tell your businesses exactly what you do every day for them. This will directly affect their bottom line. And that's probably one of the biggest benefits we found from the plan. Some of the other things is the predictable payments. it goes on a risk factor. And so when people are applying for the plan, we always tell people it may not be for everybody. If somebody's, say, example, awaiting a kidney transplant, they will write your business for this plan, but it'll be very highly rated. And so it may not save them money. So they do go through everybody and really take a fine tooth comb to the folks that are on the plan. And it is a full PPO network, including all the blue cards out of the areas. So if you travel to California or elsewhere, your folks are all covered on it as well. So the roles and the responsibilities is directed and set up by the Missouri Chamber of Commerce under our Missouri Chamber Federation. We do have a board of trustees that oversees the plan. There are 3 elected every year, and they obviously participate in the plan. Anthem Blue Cross and Blue Shield, what they do is they actually obviously provide the health insurance. And then we also partner with Consoloplex, and they do all the backroom paperwork, the filings, and all the financials on it. So the whole process is very easy. Your employer looks at it and they say, hey, I think I want to participate in this plan. The key to it, and the good thing for our chambers, is they have to be a member of your local chamber now when they sign up for the plan. And then a year from now when they want to renew their insurance. We do check this. And if you're already on the plan, you've probably received our quarterly updates of who is participating. And a lot of times people will say, hey, XYZ business has, dropped out of my chamber. Well, they have to be a member in good standing all year long to participate in the plan. And we have called employers and said, hey, we're going to have to drop you from the program if you're not a member of the chamber. And usually that spurs them on to going back to renewing their membership. It goes from there to the board of trustees that looks at the plan and looks at the applications. We did hire a plan manager to kind of help be that conduit, an attorney that's working with all of that. And then it works through Anthem Blue Cross and Blue Shield for all the administrating the claims with the plan itself. The premium, we've heard great resources across the board from that. I've got one business in Southwest Missouri. He called and he says, Tammy, he says, I'm saving $100,000 a year with this plan when he started last year. And he's like, do you know what this means for my business? I'm like, yes, this is exactly what it is for. So we're excited about that, to see that for our small businesses. Now, not everybody obviously is going to save $100 grand, but we've got businesses across the board calling every day saying how much that they are saving. So like I said, so how it works is the benefits of it. There's 10 different plans and 3 health savings plans. They're all available on all 3 networks, and depending on where you're situated. It includes domestic partner eligibility, which a lot of the ACA plans do not. It's multiple offerings. If you have a business and you have 5 or more enrolled in the plan, then you can have 2 different plans. If you have 3 or more enrolled or 10 or more enrolled in the plan, you can have 3 different plans for your employees. Kind of makes it help so that you can tailor the insurance to your businesses. All plans are on the calendar year, so they work 1 January through 31 December. The good thing about this plan is the renewal date of June 1st. So when everybody else is rushing around in October, November, and December timeframe for their renewals for January 1 renewal, ours is in June. So right now, many of you may be receiving requests from your businesses about, hey, I need to verify to my insurance broker that I'm still a member of my chamber. That's what is going on. So you'll see a lot of that happening between now and the end of May, because everybody's shooting for that 1 June renewal dates. It meets all of our federal and state mandates, so your businesses are completely covered. And then we do have the specialty offerings of dental, vision, and life on this plan as well. The good thing is if you join the plan after January 1, your rate is good through the June of the following year. So it'd be like for right now, if you join right now, your rate would be good through June of 2022, which gives a great 18-month planning for your business. So that's very positive. And then our rate renewals this year, it looks like most of them have been in the single digits. So anywhere from 1 to 9% renewal rates, which were unheard of. I know at the Missouri Chamber, we were paying over 35% renewal rates every year. So it's really saved a lot of our businesses a lot of money. So next I have a video that I have 2 testimonial videos I want to play for you. See if I can make it play.
Tammy, we're not getting audio. Is there audio to this? Tammy, can you hear me?
And then we have
Tammy,
one more. Oh, sorry. Did you say something?
Sorry. Yeah, was there audio to it, Tammy? I was not getting any audio through.
Oh, yes, there was audio. Sorry.
Under options, you will want to share your audio.
Okay. Oops.
If you typically there's 3 little dots at the bottom that said more. If you click on that, there should be an option that says share video volume or audio or something like that.
It's not. Can you hear it now?
No.
Oh, sorry. Let's try this. Sorry, folks. No, it's not bringing up anything to share. So
perhaps you could summarize what the videos are saying.
Sure, I'd be glad to. We have 2 videos of what it really are testimonials. You could also go to our website, mochamber.com, and it's listed there under the Chamber Benefit Plan. Both of these testimonials are there. So we think it's important for our businesses to hear from fellow business owners across the state. So if anybody would like, we can share this whole PowerPoint presentation with you, and then hopefully the audio will come through later. So I'm going to stop sharing my screen now. There we go. And then I'd be glad to take any questions that anybody might have about the program. Again, it's called the Chamber Benefit Plan. It's designed for employers with 2 to 50 employees. And the key is that they have to be a member of your chamber or the Missouri Chamber. But when they call our office, I tell them the same thing. Join your local chambers because you do so much more than health insurance. But it's a great way for membership recruitment and retention for our local chambers. So I'm going to wrap up my presentation at that point. So if you have any questions, I'd be glad to take them.
Sure. Thank you, Tammy. Shannon, can you hear us? Did you have any questions for Tammy?
We're having technical difficulties all over the place, aren't we? So I know that there are a few chamber businesses from Aurora that have utilized this. And I think it's a really great option, especially for small businesses who want to be able to provide some kind of health insurance that's a little more cost effective. And hang on, I'm still working on. So do they have to be a chamber member or a chamber federation member to be able to utilize these plans? Absolutely. So with the Department of Insurance in Missouri, that is our rule. It's kind of like the chain of command, if you would. It starts with the local chamber and then being a member of like the Aurora Chamber. And then the Aurora Chamber has to be a member of the Missouri Chamber Federation and the Missouri Chamber. And then so the Department of Insurance, when they ask, can you prove that this business is related to you guys? That's how we prove it. They are. So they have to be a member. And we do boot them off the program if they're not a member. So good. And it is one of the added benefits of being a chamber member, not only for this program, but a lot of times through other insurance, whether it's your business, your building, if you can show that you are a member in good standing. Is there any certain paperwork that we as chambers should be providing to our members for proof? I mean, do they want like a letterhead that says business X, Y, and Z is a member in good standing, or is it just, do they just go and look at our websites, or how do we prove that for them?
You have to provide the insurance brokers and agents a letter each year that says business XYZ is still a member in good standing of the Aurora Chamber of Commerce. It doesn't have to be anything fancy, just a one-line email to them, but they have to submit that with their renewal letters every year. So then eventually all of that information hits my desk. And as we go through and we look at them and we say, oh, business XYZ is no longer a member of the Aurora Chamber, or I send it to you and you say, hey, they dropped their membership, that's when we get in contact with the business and say, hey, we're going to have to drop you off our health insurance program. And that's when they kind of like, oh, no. Oops. Yeah, I meant to pay is what they all say.
Yeah. So do you know, on average, the like what the savings could be for a business? I know that probably each business is very different, but is there a kind of an average?
The average is, for most of them, has been between $3,000 and $3,000 and up. Like I said, I have the one gentleman that's saving over 100 grand, which is amazing. But the average is all over the place for the businesses. But the good thing of it is when you first apply, you're going to get what they call a street quote, which is like the worst case scenario. And then they can say, oh, hey, that beats my current health insurance premiums right now. And then when they fill out all the paperwork for their employees, then they can find out their real savings at that point. And honestly, I get calls every day with people saying, I cannot believe how cheap these insurance premiums are compared to what they had been paying on the open market. So
that's wonderful.
It's really just pulling everybody together.
Right. And I think it's a great program. And we've been trying to get the word out to our chamber members for a while now. And I believe there's a couple more that have gone through and gotten, as you call it, I'm getting ready to get a train. So just to warn you.
Gotcha.
They have saved significant amount of money. So, but I think they're starting to figure it out and going forward.
Good. We also have a marketing toolkit that we provide the chambers. So, because I know, having sat in your seats, I know how busy you are. What I try and do is we put all this together, and it's all your social media posts, it's your press releases, it's literally anything you want to do to market the information. All you have to do is download it, put your logos on there, and send it out to your members. And then that way you don't have to recreate the wheel, so to speak. And so we try and make it as easy as possible. And if anybody needs that, they can just get a hold of me, and I'd be glad to send them the link to the toolkit. It has a lot of information in it for them to try and make it as easy as possible for the chambers. So.
Do you know offhand how many chambers throughout our state are registered as Chamber Federation?
We have 183 chambers in the Federation right now. And I've probably talked to, and there's about 255 chambers in Missouri. So, and I probably talked to like 4 or 5 new ones in the last month and a half that want to join. And we've had communities start chambers just to get the health insurance program. So that's really positive. It's like, oh, good. Well, you should be doing that anyway and helping your businesses grow. So
right, exactly. No, it really is a wonderful program. And I know, like I said, there's quite a few businesses here in Aurora that are utilizing it, and they're thrilled every single year. So we need to get some more of them on board. So
absolutely. The more the word gets out there, the better it is. So.
Tammy, do you happen to know the renewal rates for next year, 2021-22?
Right now, what the Anthem is telling us, majority of the renewal rates will be less than 9% or less, which is very positive for the businesses out there. Obviously, if you have a 15 or 20% renewal rate, it's a huge hit to your budget. So we were excited to see those single-digit renewal rate numbers come in. So that's what we're looking at right now. So, and like we said, a lot of them everybody's renewing right now. So we'll know more after the 1st of June when everything comes through with that. So
that was going to be my another question is, can a business sign up for this any time of the year, or is it only through certain, like, are there certain dates that they can sign up, or is this a yearly or a daily thing?
Oh, we have an open enrollment year round. So say XYZ company is right now with a different carrier, they can look at this program, and if they're saving money, they can start with our program at any time throughout the year. All they have to do is stop their other one and then start paying their broker their rates for this one. So we try to make it as easy as possible for the businesses, because we know how hard it is for them to, there's usually so busy, you know, working on the widgets that they don't have time to think about this. So we wanted to make it year round. When it's not their busy season, they can focus in on it.
That's a wonderful option for businesses.
The other really positive thing is that it's for businesses, it's for governments. We have a lot of small city governments, county governments, school districts that can participate in it. It's for our agriculture community, our farmers, anybody that's in business. Our nonprofits can participate in it. Is really any business in the world, as long as it's 2 to 50 employees and they're a member of a chamber. That's the criteria. So there's no limitations there.
Tammy, I know one of the ways quite often small business owners think is to be able to speak to other businesses that are using these programs, just to understand, you know, their experiences, as a, you know, and it kind of eases their learning. Is that something, you know, not that we have to share the names of other organizations broadly, but if that is something that a business wants to learn more about, is that something can they reach out to you? And would you be able to provide some references of how other businesses have found the health plan?
We do. We have some references, and again, we don't post them because a lot of business,
Sure.
except for the ones that are on our website with our testimonials, because it's all confidential. But if somebody, for example, Aurora, if somebody was in Aurora and they called, and we would say, oh, well, first of all, do you know Shannon? And then she might be able to give them some names, or we could contact some businesses in their community and say, you know, John Smith is looking for a reference. Would you be willing to talk to him or her? That type of thing. So we'll easily be the intermediary between that and the businesses, especially somebody in their local area, because it's easy to find somebody in some of the other cities, but it's great to have somebody that's down the block from you that you know you can talk to about it. So.
Yeah, no, I'm sure that's a huge benefit, especially healthcare is just so complicated that being able to talk through a peer would be very helpful. That's
Absolutely.
Great. Thank you.
Yeah. And if it's somebody you know and trust, then you kind of like, oh, okay. So.
Yeah. And Tammy, thank you so much. This is really helpful, and I can only imagine how beneficial this conversation is to other small, mid-sized businesses who are looking for help and trying to, you know, and then growing businesses or entrepreneurs are trying to figure out how to navigate this space. So it's really powerful for them to know that they have an ally in you and their local chambers. Anything else that a small business owner should be thinking about as they think about this, you know, whether they're thinking of switching, or perhaps even more importantly, organizations that are new to this conversation? Any final thoughts that you've found helpful for other businesses to keep in mind?
Absolutely. So the biggest thing I would encourage our businesses to do is to get the quote. It's called a street quote. The list of brokers that sell it, that are members of the Missouri Chamber, are listed on our website. I'm sure the local chambers, like Shannon has it on her website, who can sell in their areas. And we encourage you to go with your local brokers and agents, because they're going to understand your business climate there. All the agents give you the same rate. So it's not like if you go to one, you're going to get a different rate than the other one. But the street quote is free. So right now, even if you're really happy with your insurance, call and get a street quote, because you could be saving money and you don't even realize it. And since there's no charge to it, and for those businesses that aren't members of your chamber yet, although you should be. If they're not a member of a chamber yet, you can get a street quote for free. If you like the quote, then you contact your local chamber and become a member. So you don't have to be a member to get the quote. You can just find out, oh, hey, I'm going to save money. And then you get all the other benefits of being a member of your local chamber as well. So that's what we encourage you to do.
That's great, Tammy. Great advice. Wonderful. Shannon, any other questions that floated in?
Not that I am seeing. Let me look real quick. No, looks like I don't have any other questions.
All right. Well, Tammy, I love it. It was short and sweet, and we gave our audience a little bit of time back today, which is wonderful. Thank you, everyone, for joining. Really appreciate the Tammy, thank you so much for your time and your expertise, and all our chamber leaders. And Shannon, thank you so much for organizing the conversation. As we mentioned, next month, we're going to be talking about COVID-related funding. So hope all of you can join us for that conversation. And there are several notes we've placed in the Facebook posting. So if anybody has questions, you have Tammy's email address. You also have link to the presentation that you saw today. And I'll also put in there a link to the survey. So if you have any feedback on how we can continue to improve these speaker events, we welcome your thoughts and guidance. So with that, we will wrap up. Shannon, thank you. Tammy, thank you so much. Enjoy your hot air ballooning. For the life of me, I can't figure out how you direct which way that balloon goes. Every time I let go of a balloon in the air, it just seems to. So I don't know how you ever make it back. The physics of it never. So maybe I'll pick your brain on that separately. That's
sounds good.
Thank you, everyone. Be well. We'll talk to you soon. Bye.
Thank you. Bye-bye.